10 signs that your heart may not be healthy. Have you ever wondered if your heart is truly healthy? Daily stress, poor diet, and a sedentary lifestyle are just a few factors that can impact your heart health. Heart failure is a serious and silent condition that can affect anyone, regardless of age. In Brazil, about 10 million people, or 2% of the population, suffer from some degree of heart failure. The situation is even more alarming among the elderly, with more than 10% of people over 70 years old affected. Heart failure is the common final stage of various heart ailments. It is a growing and often neglected problem that can lead to severe and even fatal complications, if not treated in time. This guide reveals the 10 critical signs that your heart may not be functioning well. Detecting these signs early can make the difference between a healthy life and severe complications. So let's see what is heart failure. Heart failure, HF, occurs when the heart muscle cannot pump blood effectively. This pumping is essential for all the body's cells to receive the oxygen and nutrients they need to function properly. Normal heart function. The heart is a muscle that pumps blood through the blood vessels. It has 4 chambers, 2 upper atria and 2 lower ventricles. The right atrium receives oxygen-poor blood from the body and sends it to the right ventricle, which pumps it to the lungs. After oxygenation in the lungs, oxygen-rich blood goes to the left atrium and then to the left ventricle, which distributes it to the body. The left ventricle is crucial for its role in pumping blood throughout the body. So let's see what happens in heart failure. In heart failure, the heart cannot pump enough blood. Initially, the heart tries to compensate by dilating the left ventricle to increase the contraction force. Over time, this compensation weakens the heart. In other cases, the heart may thicken its walls, which also impairs its function. Causes of heart failure. Heart failure can be caused by various medical conditions that damage the heart, such as myocarditis, inflammation of the heart muscle, which can be caused by COVID-19, heart attacks, and pulmonary embolism. Chronic heart failure usually affects the left side of the heart and can be classified into 2 types, with reduced ejection fraction. The left ventricle is weak and does not pump enough blood. With preserved ejection fraction, the left ventricle is stiff and does not relax completely between beats, compromising the blood volume ejected. Risk factors. Risk factors include age, genetics, obesity, hypertension, diabetes, sleep apnea, chronic kidney disease, anemia, hypothyroidism, hemochromatosis, cancer treatments, radiation and chemotherapy, atrial fibrillation, alcohol abuse, and coronary artery disease. Into 10 signs that your heart may not be healthy. 1. Shortness of breath, dyspnea. Description: feeling of difficulty breathing, especially with physical exertion or when lying down. Why it happens. When the heart does not pump blood adequately, fluid can accumulate in the lungs, making breathing difficult. Attention. If you start using more pillows to sleep or avoid physical activities due to shortness of breath, see a doctor. 2. Rapid or irregular heartbeat. Description: feeling that the heart is racing, tachycardia, or beating out of rhythm, arrhythmia. Why it happens. To compensate for the inefficiency in pumping blood, the heart may beat faster or irregularly. Attention. If you notice frequent palpitations or irregular heartbeats, this may indicate serious heart problems. 3. Persistent cough or wheezing. Description: continuous cough, often accompanied by white or pink phlegm. Why it happens. Heart failure can lead to fluid accumulation in the lungs, resulting in cough and difficulty breathing. Attention. A persistent cough that does not improve with conventional treatments may be a sign of heart problems. 4. Waking up to urinate. Description: needing to urinate several times during the night, nocturia. Why it happens. Heart failure can cause fluid retention during the day, which is eliminated at night. Attention. If you get up several times a night to urinate, this may indicate that your heart is not functioning properly. 5. Rapid weight gain. Description: sudden and unexplained weight gain. Why it happens. Fluid retention, common in heart failure, can result in rapid weight gain. Attention: a weight gain of more than 1 to 2 kilograms in a few days should be investigated. 6. Swelling in the ankles, feet, legs, and abdomen. Description: visible edema in the extremities and swelling of the neck veins, jugulars. Why it happens. Poor circulation caused by heart failure leads to fluid accumulation in the tissues. Attention: swelling that leaves marks when pressed, pitting edema, is a classic sign of heart problems. 7. Inability to sleep, lying down. Description: difficulty breathing when lying down, needing to sleep in an elevated position. Why it happens. The horizontal position can exacerbate fluid accumulation in the lungs, making breathing difficult. Attention: if you can only sleep sitting or in an elevated position, seek medical advice immediately. 8. Generalized weakness. Description: feeling extremely tired and having difficulty performing daily activities. Why it happens. Heart failure reduces blood flow to muscles and tissues, causing weakness. Attention: if simple tasks like climbing stairs or carrying groceries become exhausting, it is a warning sign. 9. Loss of appetite. Description: loss of appetite, nausea or feeling full. Why it happens. Edema in the digestive system and poor circulation can interfere with digestion and appetite. Attention: if you lose your appetite for no apparent reason and feel frequent nausea, see a doctor. 10. Mental confusion. Description: difficulty concentrating, memory loss, or disorientation. Why it happens. Heart failure can alter electrolyte levels in the blood and reduce blood flow to the brain. Attention: sudden changes in mental state, such as confusion or disorientation, should be evaluated by a healthcare professional. If you or someone you know is experiencing one or more of these symptoms, it is crucial to seek medical attention immediately. Detecting heart failure early can significantly improve the quality of life and the effectiveness of treatment. Treatment. Treatment for heart failure includes medications that improve heart strength and relieve symptoms, as well as lifestyle changes such as reducing salt and fluid intake. In severe cases, devices like cardiac resynchronizers or heart transplants may be necessary. Early diagnosis and treatment are essential to improving quality of life. If you or a loved one is experiencing these symptoms, consult a doctor for proper evaluation and guidance.